Now you mentioned, a few chemicals. Are there other chemicals that we should be watching out for with regard to protecting ourselves from exposing ourselves to toxic chemicals?
Well, these are the ones that are best associated with Parkinson's disease. So, people know about the forever chemicals which are really linked to cancer. Other pesticides are linked to other diseases. We should be thinking about what's the benefit we're getting from the use of these chemicals. And so for like dry cleaning chemicals, we use these chemicals so our clothes don't shrink. And the cost of that is cancer and likely Parkinson's disease. I just don't think the trade-off, we're not thinking clearly about the risk-benefit trade-off. There are thousands of people who've likely died from cancer from these chemicals, which are used for degreasing and dry cleaning, and they've been around for 100 years. Companies advertise safer alternatives to these chemicals. It just doesn't make sense.
Thank you. And our next question is coming from Cheryl. Cheryl, please state where you're from and ask your question.
I'm from California. Thank you, Dr. Dorsey, for all your great work. I'm wondering what you think of Dr. Joel Fuhrman's viewpoint that Parkinson's disease in some of his vegan patients, long-term vegan patients, was caused by a DHA deficiency. Do you think that could ever be a causative factor?
I'm unfamiliar with the work and unfamiliar with the association. As I mentioned earlier, people with Mediterranean diet, a vegan diet, are less likely to be exposed to animal products, especially milk, which can concentrate pesticides, and therefore I would think would be at lower risk for developing Parkinson's disease. I don't think a nutritional deficiency in and of itself is likely a major cause of Parkinson's disease.
Thank you.
Thank you. And the next one is going to be Marty. Marty, please state your name. Please state where you're from and ask your question.
Hi, I am from Hollywood, Florida, and thank you for the presentation. Very informative. You mentioned the chemical is in the decaffeinated coffee. Is it the same if it's organic, or does that not have it in there because it is organic?
So this was in the 1970s that makers of that they were using chemicals like TCE and chemicals like it to decaffeinate coffee. My understanding is that those uses have been banned in the United States. So your decaffeinated coffee shouldn't have these chemicals in it anymore, at least in the United States.
Okay, thank you.
Great. Thank you so much, Doctor. And are there any supplements that you would recommend in general health and specifically with regard to I guess healing better or dealing better when you have Parkinson's and preventing Parkinson's? I
wish. There have been the supplement that has been studied the most in Parkinson's disease is coenzyme Q10. The brain is about 3% of our body mass, but it consumes 20% of our energy, our glucose. And all these environmental factors I talked about all damage the energy producing parts of cells called mitochondria. So people looked at supplements that would enhance mitochondrial function, including coenzyme Q10. However, a large study of coenzyme Q10, one of the largest studies ever conducted in Parkinson's disease, showed it not to be helpful in people with early Parkinson's disease. So unfortunately, there's no supplement that we know of currently today that's likely to be beneficial for Parkinson's.
Thank you. And so you had mentioned during your presentation about the fights against polio, HIV, AIDS, and breast cancer. Do you and obviously there's a certain critical mass that needs to happen in order for those who have been successful in the past. Do you see that that critical mass accumulating now with regard to the causes of Parkinson's and banning these chemicals?
I wish, 1 in 10 Americans over 65, 1 in 10 Americans over 65 today have either Parkinson's or Alzheimer's disease. 1 in 10, but where's the march been for Parkinson's disease or Alzheimer's disease or ALS? Brain diseases are the leading source of disability in the world. Brain diseases, more than cancer, more than COVID, more than infectious diseases, more than heart disease, are the leading source of disability in the world. And I think many of these, I focus on Parkinson's disease, but I think many of these other diseases have a large preventable component to them. There's no reason that we need to be losing our minds and our bodies and the control of our most important functions as a consequence of getting older. We can live in a world that's largely free of these diseases, just like people did likely for centuries before Dr. Parkinson's, where Parkinson's disease was incredibly rare. Why we're paying a really high price for these diseases. Just to give you a flavor, Medicare alone spends $25 billion per year caring for people with Parkinson's disease. That's 100 times more than the National Institutes of Health spends on research aimed at treating Parkinson's disease. We just need to get our priorities in line and think about a world that's largely free of Parkinson's disease, where Alzheimer's disease is less common, ALS is less common. We've done this before for polio. We've done this before for smallpox. We've done it for typhus. We've done it for scrotal cancer. We've done it for cholera. We can do it again.
Thank you. Our next question is coming from Debbie. Debbie, please state where you're from and ask your question.
Hi, yeah, thank you for letting me ask another question. I want to ask something. I'm not sure if it's going to come out right. My father had Parkinson's and died. So I guess what I'm looking at is I'm thinking my lifestyle has been a little different, and I've adopted a lot of these concepts that you were talking about a long time ago as far as prevention. And it seems like there's been some effort, although not very good in the United States, for some of these chemicals, like you said, to be banned and replaced. So what I want to know is, like, statistically wise, as we see those older generations pass away, would you expect Parkinson's to go down, or is there an actual statistically like increase of Parkinson's in younger people, or starting earlier, or like, is it something that you see moving in the right direction? Because, and the other factor is that people live longer. So maybe they would have had Parkinson's before, but they died of something else. And now that they're living longer, that loss of Parkinson's is coming out because people are successfully staying older longer. So I'm just wondering if any of the efforts of either people to eat better, be healthier, like my father didn't exercise, and things like that, would those things start to maybe shine through, hopefully, in any way, or it's not happening?
So Debbie, very sorry to hear about your father. Parkinson's disease is now the 14th leading cause of death in the United States, 14th leading cause of death, and rising rapidly. The health we have today is a reflection of the environment that we've had in the past. The health we have today is a reflection of the environment that we've had in the past. And so if we had high levels of TCE in the past, we're going to pay the price now. If we've had high levels of pesticide in the past, we're going to pay the price now. If we've been smoking and been exposed to secondhand smoke and air pollution in Southern California and traffic, we're going to pay the price now. So what we need to do is make our environment cleaner now so that future generations are at lower risk of developing this disease. And we saw that in the Netherlands, where the environment got cleaner and the rates of Parkinson's disease got better. We've seen the flip in China, where the use of pesticides is increasing. Use of trichloroethylene in China is half the market. It's increasing. Air pollution in China is increasing. People in China living there are going to pay a really high price in terms of their health in the future. If we create a world where our water is clean, where our air is clean, where our food is clean, we will all live longer and, more importantly, healthier lives. These are all things that are eminently achievable. You know, we spend 40% more than any other country on healthcare in the United States. And our life expectancy is less than that of our peer nations. Americans live 5 years less on average than people in France. And we spend about twice as much on healthcare. If we focus on the environmental determinants of healthcare, clean air, food, and water, we can all live longer, healthier lives, free of diseases like Parkinson's disease, free with less incidence of cancer, less incidence of Alzheimer's disease, less incidence of ALS. And this would be a great gift, not just for us, but for future generations as well.
Doctor, you mentioned a cleaner environment. Is this, are the chemicals that you mentioned that contribute to the increase in Parkinson's disease, are they something that can be cleaned out of the environment?
Yeah, absolutely. So we can stop using these pesticides like paraquat and reduce our exposure to it today. And people are, you spray these pesticides and you inhale them. It's worth knowing that almost all these chemicals are inhaled. Our nose may be the front door to our brain. One of the earliest features of Parkinson's disease and Alzheimer's disease is loss of smell. One of the earliest pathological findings is the misfolding of these proteins in the smell centers of our brain. I told you TCE is really hard to clean up, but it's really easy to prevent people from getting exposure to vapor intrusion by putting in remediation systems. The average cost of these systems, I'm told, is like $2,000. If you have a $200,000 home, a 1% investment to make sure that your kid doesn't breathe in these toxic chemicals, which kids in Newport Beach, California, where I went to high school, are breathing in these chemicals right now as I speak, because they are living on top of a former aerospace facility. They can decrease their risk of ever developing leukemia as a child, develop the risk of decreasing the risk of developing cancer as an adult, and decrease their risk of developing Parkinson's disease as an older adult. It's also worth noting it's not just aging, longevity and how long life allows these diseases to unfold. If everyone died at age 40, none of us would get lung cancer. You need to live usually to your 50s or 60s to develop lung cancer. In fact, if you look at the graph of the number of new cases of lung cancer as a function of age and the number of new cases of Parkinson's as a function of age, they're indistinguishable. I don't think any of us would say that lung cancer is a disease of aging or a natural consequence of aging. And I don't think Parkinson's disease is a natural consequence of aging either. It's a natural consequence of the environments that we're creating for ourselves.
So given that other countries have banned these very toxic chemicals that have been so strongly linked to Parkinson's, and I'm sure other diseases, why do you think that the United States government hasn't banned them and allows them to persist in our system?
I think there are a couple of things. One's agnotology, the deliberate production of ignorance by these companies. You saw what the makers of paraquat have done, and they succeeded. They had a campaign of freedom to sell. And not only, they had this research, right? Their own research, which was far ahead of the academic research, linking exposure to paraquat to symptoms of Parkinson's disease in laboratory animals in the 1960s. They had this information. Did they withdraw the chemical? No. Did they introduce a safer alternative? No. They doubled down. They adopted a campaign, according to The Guardian, called a freedom to sell. And that freedom to sell has led to a freedom to create, increase the risk of Parkinson's disease for thousands, if not millions of people throughout the United States and around the world. So that's one reason. Two, we need to look at regulatory capture, which is control of regulatory agencies by the industries. You saw this with their campaign to discredit my colleague, Dr. Debbie Corey-Schlechter, across the street by preventing her from serving on the EPA advisory panel related to pesticides. They hired a third-party lobbying firm to discredit her in private to the EPA and installed an industry-friendly scientist in her place. They have succeeded in this. If we allow wrongdoers to continue to market their products that they know are unsafe to our health, and we allow them to get away with it, they're only going to be emboldened and only going to seek to do more of it in the future. And again, this isn't my opinion. This is what The Guardian reported, and you can just Google Guardian and paraquat and read the article yourself.